Bristol, Mr. Montigny.
My words of relief, but also commendation to the Majority Leader. I was preceded by three healthcare chairs, Senator Moore, Senator Pacheco, and Senator Chandler. I, too, held that role for several years. Long time coming, and implied in any deal this complicated that is actually negotiated. I think there's a sense that all sides perhaps did give. But I want to say that having not been pleased with a lot of Kissinger's work, I think that the Rosenberg doctrine here is far more successful in the long run, I hope. I want to take 1 minute, though. Again, I understand, again, that there is an implication that when something this complex is, politically complex anyway, is negotiated, there is a sense that all sides gave. I agree with that. But I want to spend a minute saying that I think the nurses and their association need the most commendation. They've taken a lot of hits from folks over the years I think it's been unfortunate. I think anybody who has spent any time with someone they love in the hospital realizes that nurses are unappreciated, not just nurses, but generally direct care workers up, from the CNA all the way up to the most sophisticated nurse practitioner and nurse's assistant. They're underappreciated, overworked, and underpaid. And I don't say that lightly, because I think it's a very complex setting, both in the emergency room as well as in all of the hospital units. But I've noticed, after years, I've chaired the healthcare committee many years ago, I've noticed that we spend more money, that we have an expansion on the federal level. We have near universal health care here on the state level, and yet what I've heard from nurses is how much more difficult and how, in a sense, how much more difficult it is to serve the patient. At the end of the day, it's the doctor or nurse or direct care patient relationship that should be sacred, and it has not been sacred. Unfortunately, there have been hospitals in this Commonwealth that out of one side of their ledger they talk as a nonprofit doing important charitable work, and out of the other side they operate as aggressively in cost-cutting as any for-profit. You could chalk that up to competition. You could say, well, that's essential in this day and age, or you can conclude, as I have, that many of them have not put the nurse-patient relationship first. So I'm most pleased with the compromise, because I think it's essential. I think deciding on the ballot may have been unwise. However, I commend all of the advocates for patients that were on the right side of that question. I commend them for putting the question out there. I firmly believe that the other side in this negotiations would not have come to the table without this ballot question. Despite the magic of the Majority Leader, I don't think that the Majority Leader would have been at a table with counterparties that wanted to negotiate this if the nurses hadn't said enough is enough, the patient comes first, and at the time being, they're not put first. Thank you, Madam President.